The Job Creators Network Foundation has put out a plan called Healthcare for You, and it's been endorsed by Iowa Governor Kim Reynolds. What I like about this is we talk a lot on this show about healthcare. What I like about it is we can get into some details. What are some actual solutions to the issues? Elaine Parker joins me. She is president of the Job Creators Network Foundation. Elaine, welcome back to WHO in Des Moines. Good morning.
Hi, Jeff. Thanks for having me.
Absolutely. You have created, and the foundation's created, a Healthcare for You plan. It is starting to get some attention by governors across the United States, including Iowa's governors. What is the key to this, Elaine? What's the key to some of the elements in this plan that's attracting this attention?
Sure. Well, the Job Creators Network Foundation and a physician organization by the name of Physicians for Reform have conducted the largest market research healthcare study involving more than 25,000 American voters. So not a poll, not a survey. This is market research. And from that, we've developed a framework for healthcare reform that will repair, restore, and improve the patient-doctor relationship, remove the D.C. bureaucrats and politicians from healthcare decisions, and increase choice and competition, which brings down the price. That is an economic fact, and healthcare is no exception to those economic facts.
Well, Elaine, let's go to some of the elements that you talked about here. You talked about repairing that relationship between the physician and the patient. Repair suggests damage. How has that relationship been damaged over the past few years?
Sure. I mean, under Obamacare, we can all start from the premise of the healthcare system was not a perfect system prior to Obamacare. But under Obamacare, there's a literal, figurative, and literal screen between doctors and patients that has literally separated them from being able to make the decisions. The decisions are not being made in the exam room between doctors and patients. Doctors spend as much as 50% of their time doing paperwork, and more than half of them have had to actually close their practices or have been absorbed by these massive hospital systems, and they actually work now for the hospitals. And so their allegiance, if you will, is to their employer, because that's where they're getting their paycheck. And what we want to do is bring back the strength of that doctor-patient relationship by reducing the regulatory and the complexity of our healthcare system. You know, it's interesting, Jeff, our healthcare in and of itself is not expensive. When you look at primary healthcare, it is not expensive. The complexity of our system and how much government intrusion we've had through regulations has skyrocketed the cost of healthcare. And what we need to do is look at how to reduce that and not increase that through a Medicare for all top-down approach, because this is going to be the alternative to Medicare for all. So the American people will be able to choose between Medicare for all or healthcare for you.
So, Elaine, of course, there are a lot of candidates crisscrossing Iowa right now that are touting Medicare for all. And I think the comfort that some people find in that is, well, somebody is going to be my advocate when I'm worried about how much health care is going to cost for me. And when you say your plan, it introduces choice and competition, some folks say, well, then how am I not on my own against, all these big insurance companies or these big medical establishments? So how do you explain that to people that say, hey, how do I benefit from choice and competition?
Well, first, we have to fundamentally change how we think about health insurance in this country. This is about personalized health care, and all of our market research came back saying that that's what the American people want. Mm-hmm. And remember, we had in our study more than 25,000 American voters, and these are Democrats, Republicans, and Independents, all saying, I want personalized health care. I want to be in charge of my health care dollars. So let's fundamentally change how we think about it, and think about how we can, how patients can own their own insurance, how you can own it, you can take it from job to job, you can choose your plan and choose your coverage, and get the same tax break savings that employers get who currently offer health insurance to their employees. I mean, 80% of us, 85% get our insurance through our employers.
Right.
They own it. If we change jobs, we can't take it with us like we do our car insurance or our life insurance. So if we can roll back the regulations on HSAs, health savings accounts, which were severely limited under Obamacare, and allow employers to actually opt out of providing health care insurance, but fund tax-free dollars an HSA patients are now in control of their healthcare dollars, and they can actually shop for their own health insurance and shop for what they need, not for what the government bureaucrats tell them they must have in an insurance plan.
That's president of the Job Creators Network Foundation. The plan is called Healthcare for You. Elaine Parker is the president of that foundation. Elaine, thanks for taking the time to talk to me today.
Thanks so much.